Hello, everyone, and welcome back to another episode of Acupuncture is My Life. Now, in this episode, I want to talk about aneurysms. And I feel that this is a pretty important topic to go over because, there are certain signs and symptoms that you need to pay attention to and catch early if you're presenting with these signs or symptoms for the betterment of yourself and having the ability to survive it. Because aneurysms have taken the lives of many individuals, and they would just assume it's just a headache, I'll get past it. And then there's other symptoms that go along with it that'll let you know it's not just a headache. And just for the record, so you know, an aneurysm it's like an abnormal bulging in the wall of an artery or vein that fills with blood. And yes, arteries are blood vessels that tends to send oxygenated blood from the heart to the rest of your body. And an aneurysm can happen in any vein or artery within your body. And this includes your brain, this includes your abdomen, this can include your intestines, it can include your heart as well. Now, I will bring this to your attention. You see, most aneurysms don't cause any symptoms until it's like really big and blood starts to leak out of it and it ruptures. And this isn't an age-specific thing because I've encountered younger people that feel only old people get aneurysms, and that's not true. You see, aneurysms can happen at any age, but they're more common during the ages between 30 and 60 years of age. And the symptoms usually depend on where it occurs in your body and how large the aneurysm is. And they do have common symptoms, one being headaches, sudden headaches. And this is why I said earlier, don't just blow off a headache as just being a headache, because you can also experience pain in the abdomen, pain in your neck or your chest, blurred vision, skin discoloration, and more. And you see, an aneurysm can present in the size of a small, like a small berry, okay? But if it bursts open, then symptoms can happen like boom, really quick. And it'll require immediate medical attention. And this is why I said to you, it's important to make acupuncture a part of your life. Because if you're doing regular wellness visits with an acupuncturist, the early signs will be caught immediately, because it's definitely a sign of blood stagnation, and an acupuncturist, or a form of blood stasis or stagnation, and an acupuncturist will pick this up right away. But you see, with regard to the various types of symptoms that can present, aneurysms don't just occur in the head or the brain. And I've even surprised some of my new patients by telling them that. But some of the more common symptoms, again, is sudden headache, abdominal or abdomen or back pain, discoloration of the lower extremities, dizziness, blurred vision, confusion. And with me saying that there are various types of aneurysms, they're usually determined by their location. And the symptoms, again, will vary depending on if the aneurysm had burst or if it's large and it's pressing against another part of the body. Okay, but the ones that most people tend to be familiar with is a cerebral aneurysm, and that's in the head. It occurs in the arteries in the brain, and it can affect any area of the brain, but they usually form inside of arteries at the base of a person's skull. And usually when a cerebral aneurysm becomes large enough, it can press against brain tissue. And when it presses against brain tissue, it'll cause pain behind your eyes and possibly paralysis on one side of the face, pupil dilation, drooping eyelids, which is called ptosis, and double vision or blurred vision. And there can be more severe symptoms if this aneurysm bursts or leaks blood, which you may hear a doctor call subarachnoid hemorrhage. And the brain damage caused by this type of bleeding is known as a stroke. And the primary symptoms of a burst or a leaking cerebral aneurysm can include double vision, again, sudden headache that can last for like hours or even days. And there can be neck stiffness, there can be nausea or vomiting, and sensitivity to light. There can even be seizures. There can also be loss of consciousness, paralysis or weakness of the arms or legs, and even in some cases, death. So this is why I'm bringing this up, because it's important that listeners of Acupuncture is My Life are aware of this, and hopefully they can spread the news. And then you have another form of aneurysm, which is called an aortic aneurysm. And an aortic aneurysm happens in the aorta, which is the main artery that sends blood like away from your heart and throughout the rest of your body. And it can happen, let's say, in the chest. I'm trying to think of like some symptoms, but it can happen like in the chest or below the chest, and you'll experience like sudden pain in your chest or your upper back. You could struggle with breathing or swallowing, and you can also experience shortness of breath. And you see, like, abdominal aortic aneurysms are more common than, let's say, thoracic, which is in the chest area. The upper part of the torso, thoracic aneurysms. And symptoms of abdominal aneurysms tend to be like pain in your back or on your sides, or pain in your groin or buttocks or your legs, and you'll even notice discoloration of the lower extremities. And this is why I'm constantly saying make acupuncture a part of your life, because with that being the case, any disturbance in the free flow of chi or blood throughout the body anywhere, an acupuncturist is trained to pick that up. Just the slightest. And we would do what needs to be done to rectify that. And sometimes it'll call for adjustments to your diet, so that, that's when it begins to sort of slip out of our hands and more on you, because you are what you eat. It's all about what you put in your mouth, and how much sleep you get at night, and how much physical activity you engage in during the day. Because, just even with those three things, you're adding 10 years to your life. But, I want to stick on aneurysms and the flow of chi and blood throughout the body. It's important when it's harmoniously flowing throughout the body the way in which it should. And there are so many things that can disturb the flow of chi and blood throughout the body. And again, it's why I'm always touting acupuncture, making acupuncture part of your life, because health is wealth. The wealth it's not in your wallet or your pocket or your purse. And the wealth is not under the doghouse in the backyard. And it's not in any type of bank account, whether it be checking, savings, investment, retirement. It's not. It's in you. That's where the wealth is. And the more you consider making acupuncture part of your life, the richer you become. But like I said, there are various types of aneurysms. There's even popliteal artery aneurysm, which is behind the knee, which happens in the popliteal fossa. Okay? And symptoms in this case usually present when the aneurysm is like large and it puts pressure on structures in the legs, including your veins and your nerves. Okay, and you can experience symptoms like leg pain, paresthesia, which, like if you're feeling pins and needles on your skin, muscle weakness, thrombosis, which is blood clots, a pulsating mass in the back of your knee. Another one is splenic artery aneurysm, and this is when your spleen is involved. The splenic artery, which is responsible for providing major blood flow into the spleen. Like some of the symptoms for that type of aneurysm is abdominal pain that radiates in some cases up to the left shoulder. You'll even experience vomiting blood. You ever notice yourself vomiting blood? You get to emergency care immediately. Okay, but I wanted to have a brief conversation on aneurysms and its symptoms, because when there are individuals that'll experience it and misinterpret what it is, and this is something serious. And it's not to put fear in you, because whether you're afraid or not, all you simply have to do is just make acupuncture part of your life. That's it. Because acupuncture is my life. What's yours?